Thanks everyone for being here. Just want to start off with just an update. For the last few days, I've had the fortunate opportunity to take a trip from McConnell Air Force Base out to Travis Air Force Base in California. I haven't spoken about it on social media. I normally don't post when I'm out of town because everyone knows where my family and my wife, where we live. However, I wanted to give someone an update on this trip. We went out with local leaders who were honorary commanders with the Friends of McConnell organization, and one of the takeaways that or really missions on my part, was to learn more about how our Air Force bases interact with our local community and the different assets that they present to our economic development strategy. We do know earlier this year, being in a room with the leadership over with Nova Coast, one of their deciding factors when it came to picking Wichita was the potential of having well-trained folks from McConnell Air Force Base who are already trained up in cybersecurity, staying here in Wichita and possibly being a pool of potential employees. And then this trip also allowed me to not just represent Wichita, talk about what we have going on here in Wichita, but also just kind of survey the different types of jobs and opportunities that the base presents, and how can we be better partners with McConnell Air Force Base so that those folks who are getting out of their service might have an opportunity to stay here in our community and somewhat satisfy that part of the problem we have, which is folks leaving Wichita who have opportunities in other areas. We want to make sure that Wichita becomes home for folks who are serving in Wichita, and it was really great to be out in an Air Force base like Travis, which is huge. California, it's internationally known, and to hear about the real positive reputation Wichita has and the positive reputation that McConnell Air Force Base has. So while out there meeting with folks, we're never really sure if the person I'm talking to is going to wind up in McConnell and then after their service have the opportunity to stay here in Wichita. So it was a great trip to learn more about the airmen and women, their stories, and how the military provides opportunities for them, but also to learn more about how we can be better partners with our Air Force community and with our military community in the future as we look towards economic growth and economic opportunities for them and also for civilians in our area. And it was also, I'm not gonna lie, it was fun too. It's fun to hang out and be with folks who also have that heart to serve, who put it all on the line for our country and our community. I feel a little even more refreshed just meeting these folks and having the opportunity to learn more about what they do. Next, we'll chat about the new Fresh Air Baby Camp, which, by the way, we didn't name. It's the Fresh Air Baby Camp has a long history here in Wichita, and the building has just been renovated and will likely and is up for public use. So the Delta variant continues to impact our community. It's a great time when we're thinking about celebrations and events, to have those events outdoors, especially as we get into the fall weather where being outdoors is much more comfortable. So with that, the Parks and Recreation have a revamped page where you can rent park and recreation facilities. So new to our rental offerings is the Fresh Air Baby Camp in Riverside Park, the historic site of the National Health Program to help at-risk infants during the turn of the century by offering them fresh air. So I had the good luck to be at their grand opening over a year ago, where they told us about the history of this, where it was, and the building is amazing. It's fully renovated and it's mostly windows. But again, it was at first to promote fresh air for babies who have had negative health conditions, so that hopefully they could bounce back. So the residents can also rent stages, recreation centers, and more. So be sure to visit wichita.gov/parkandrec/rentals for more information. Second to last, I'm going to go ahead and give an update on our splash pads. September 20th, all the City of Wichita splash pads will only be open on Fridays, Saturdays, and Sundays. All locations will be closed Mondays through Thursday to the public. The splash pad season will end Sunday, October 3rd, unless the weather alters before then. It was a great pool season, and we are so glad to have our renovated pools and splash pads open to the public, particularly after last year when we weren't able to do so. So we just want to thank everyone who did take advantage of our new splash pads, who did get out and utilize our pools. Last year, it was heartbreaking to not be able to have these open. But we did, just fast forward on some of the renovations, and we're very proud of the product this year and getting those, getting those in a position where folks can get back and utilize them. And we are happy that we were able to extend that season, but again, that season does have to come to a close, and we are looking, October 3rd is likely when the splash pads will be closing. Hispanic Heritage Month will be held from September 15th through October 15th. So please come out on Saturday from 11 a.m. to 11 p.m. for the Latin Fest ICT, which is held in Old Town Square. Latin Fest ICT is a unique cultural festival celebrating Wichita's Hispanic community in the Hispanic Heritage Month. It's the third annual event, and it is free and open to everyone in the public. There will be cultural performance, authentic food, 2 live bands, and much more. So please bring your lawn chair and get ready to enjoy a day of diversity, culture, and plenty of fun. So with that, I'll take questions about anything at all.
Can you expand and talk a little bit more about McConnell and how you want to try to keep those people here in Wichita after they're finished serving, and what the city can offer them?
Definitely. One of the number one, I guess, opportunities, but also issues right now, according to the Chung report, is Wichita losing pretty much young folks under the age of 40 who have opportunities in other cities. So we're thinking about folks who can get similar jobs, similar careers, either in Wichita or in Des Moines, Iowa, and Tulsa, and these cities that we compete against. And according to the research done by the Chung report, they are choosing these other cities. Also, an overwhelming percentage of the folks who fall within this category are actually either women or members of minority group. So part of the strategy that I've had as mayor is how do we make Wichita more opening and welcoming to folks who, not only generationally, but also within these other groups that feel that Wichita could be a place for them to lay down roots. Now with that, with McConnell, we have people who are coming in from all over the country here into Wichita, and they're trained. They have all that resources that the military is putting into them, and then on their way out, if they are retiring or switching over to a reserve position, some folks might think about going back home. But the reality is home might not be home anymore if they've been gone for 4 years, 6 years, or longer. We think that Wichita is a really good place to lay down roots. So one of the things that we want to do is tap into this incredible resource of potential employees here on the base, and to have a better communication with folks on the base, better relationships so they can come out into the community more, become a part of our community more, and hopefully when they have the opportunity, if they decide to leave full-time service in the military, to come on out and take a job here in our Wichita community. And again, it's not just on the employee side, which we obviously all need more workers, more folks working in our community. The data has shown that, but also, as I mentioned, it's an opportunity to attract other employers, people from different businesses from the coast. And I know that over this last year, McConnell has been brought up in some of these meetings with leaders who are looking to expand into Wichita.
Talking a little bit about the COVID testing site, that I know the county has it, but I guess, obviously it's become very busy and you now have to call ahead and make appointments. Is this something that maybe the city might look at, maybe possibly getting involved and maybe opening up a site also? I mean, getting involved.
So one of the things right now that we have to deal with head on as leaders is the fact that COVID is on the rise. This Delta variant is nothing to play with, to joke around with. And frankly, we've lost a lot of progress. We've had our numbers down at the beginning of the summer. We were doing really well. And now hospitals are stressed, just stretched to their limit. And we're seeing the numbers increase at a rate that we haven't seen since before the vaccine. When it comes to the city's role in preventing spread and also having testing, really, we need to do more than just having testing sites. The county took some of the CARES Act money last year, was able to actually buy an entire lab working with Wichita State University so that we could have almost, or near, not instant, but very fast testing. We utilize that lab, my family does. We just got my kids tested last week because my little guy has congestion right now. And you get the results turned around within 12 hours. So as far as our role in expanding testing sites, our role is more so to come alongside the county health department, asking what do you need? And with that, we're able to utilize some of our resources like we have done with the old library, where turn that into a vaccination site, which frankly is I think is one of the best in the country. We have folks who come in, go in and get vaccinated at the height of that program, and they sit and they enjoy the old library and the architecture. It just had lots of positive results, and that's usually what I think taxpayers want to see from their local government, is working together, not duplicating services, but seeing how can we deliver those services more efficiently and frankly better. So right now, when it comes to testing sites and increase in tests, I think that our goal is to work with the county health department and to figure out how we can help accelerate what they are doing, and also work with our partners over at Wichita State University with their lab as well.
How do we, as a city and county, try to get these people that haven't been vaccinated? What do we have to do? We've offered pretty much everything.
Right. So it's a tough question because frankly, there's a lot of variables I think are keeping people from being vaccinated, and I got to tell you, I don't have the perfect answer. My mother-in-law, love her to death. She's still not vaccinated. I can't get her vaccinated. She's just kind of on the sidelines seeing how it goes, and there's a lot of people like that. And I think the best thing to tell folks is frankly, talk to your doctor. Talk to someone you trust. I think that a lot of us, we are not medical professionals. I'm an elected official, which means there's a downgrade of trust with some people, just like there is, we're supposed to be skeptical of our elected leaders. So don't listen to me. I can give you all the information I have, which my whole world has been researching this stuff for the last year and a half, but you don't have to listen to me. Call your doctor. Call the person that you bring your child to when your child's sick. Call the person who was there when child was born. Call the person, frankly, that you would call if you caught COVID, and ask them about if you're a good candidate for the vaccine. I think that needs to be the message, is talk to someone you trust who's an expert in the field. And sadly, I also think that there are some people who are looking at this through a political lens instead of a public health lens, and there's not much really to change with that. When people say masks don't work, that's a political statement. That's not a medical statement. There's not a medical organization in our community or in our country who would back that up. Or if they say vaccines don't work, there is not a medical organization in the entire world that would agree with that. So those are political statements. So trying to separate the politics from the actual health, public health, I think is really important. But again, you don't have to take my word for it. Call your doctor. Call the person that you trust and ask them if you're a good candidate for a vaccine. And I think that the more we can get with folks interacting with those they trust, the more likely they'll take us up or someone else up on the opportunity to get a free vaccine.
You talked a little bit about that COVID hospitalization. We are at 4 times the number of people battling the virus in hospitals, 4 times the number of people in ICU with COVID as we were last year at the precipice of flu season, respiratory virus season. From speaking with hospital officials, they're very, very worried about this unseasonable capacity. Have you had conversations with hospital officials about contingency plan as far as capacity, and if it comes down to it, who's receiving care when it's a COVID patient or somebody else with a medical emergency? Is that a conversation that?
Really good question. And for those who are watching the questions from the Eagle reporters about conversations with the hospital community about them hitting that ceiling when it comes to patients. Frankly, there's a few things that are different this time around than last time. One of them, when we talk about capacity, we are talking about staff. All right, we're not so much talking about setting up tents or setting up cots. We're talking about staff, we're talking about resources, and because this virus is just running through states that aren't doing any type of precautions at all, we can't get the same type of traveling nurses that we used to be able to get. Like they're needed in Florida, they're needed in Texas. So we're seeing, again, our hospital is just really at the brink at this point. I haven't had those conversations about what is their process for, God forbid, rationing care, but I am reading articles in which that is becoming a situation. And before this wave of COVID, being on those calls with the hospital leadership, they would talk about, in one or two scenarios specifically, people who didn't show up to the hospital because of COVID, because of it being overrun, when they had chest pains, and showed up when really they were in the midst of a heart attack. They would have came earlier, but they heard that the hospital is overrun, and then it came too late. And that was a preventable death that you won't see in the COVID numbers, but they're real. And frankly, for those of us who are vaccinated or wearing masks, doing everything right, we are the ones that also might end up in a situation where my kid falls out of a tree, breaks his arm, and I can't get him to a doctor in time. Like I can get him to the hospital in time, but I can't get him to a doctor in time in which he can be seen without experiencing continuing trauma. So it's real. I think some of us want to kind of push it out of our mind as if like that was last year. We don't want to think about as much. But what you're talking about is very scary to have. Us on the brink of stretching out our capabilities medically. And that's one of the reasons why, again, everyone's sick of talking about this, and I am too. Like, I wish we were talking more about the fun stuff we have going on. But in Wichita, we don't bury our heads in the sand. We face problems head on. We did better than every comparable community when it came to COVID because we took it head on. And we'll continue to do so, and to do that, we have to be upfront and frank with the public, and the reality is our hospitals are begging us to do the right thing as individuals so that they can have they can get caught up. They can have some sense of normalcy in these upcoming weeks.
I have another question. Basically, hold on here just a second. I'm going to switch slides so I can.
I'm going to switch to on my good side. Good luck finding it.
There we go. So yesterday, some city leaders gathered with police on the Enigma bar shooting. I guess your thoughts on that, and I guess Crime Stoppers upped in a reward.
Yeah, I've been on the phone with the chief getting updates on this, and it's a terrible situation. It's absolutely heartbreaking. And it's national. My sister in New Hampshire texted me the day and said, "Hey, we just got a report of the mass shooting that happened in a bar here in Wichita." The suspect is in his early 20s, has a long record, should never have access to a firearm, is not someone who should legally have access to a firearm. And frankly, we have to have a discussion about, and we're doing this, to be frank, we aren't just funding our community policing strategy, but we're also adding inroads for officers when they are encountering young people who might be heading down the right path, to recommend those people to go into different organizations, sports, into different programs. And we talked about this last year, and we have to have a conversation about what can we be doing more of to show young people who might be heading down that wrong path better options, and those options are ones that lead to opportunity. And then also, we got to do better at talking about how we can resolve problems without using a lethal weapon. And that's a conversation I think we should be having more of, where we are seeing people who turn to a weapon as a way to resolve what otherwise is just a conflict that you can resolve in other means. And frankly, we also have to have a conversation about locking up firearms, not keeping them in your car. And if you do, having them secure. A huge percentage of firearms that are actually stolen out of cars wind up in crimes, wind up in the hands of the suspect now who we're looking for, who otherwise couldn't get one because legally that person should never have had one. So we have to talk about what more can we be doing in order to make sure that we have responsible gun owners not taking that extra step so that guns are less likely to make the way to the streets. And we saw that last week with our police department giving out gun safes. Those small gun safes, they're about 30 to 50 bucks roughly, and passing those out, trying to promote that proper usage of weapons by keeping them locked up and out of the hands of other folks who shouldn't have them.
I think another thing, you kind of mentioned it, even myself, we need more mentors in the community to step up. I mean, if I got a few hours free, there's no reason why I can't help some youth and maybe steer them the other way.
Yeah, and for those who didn't hear, he's referring to mentors, and that's a lot of what, some of the stuff that we talk about community policing is getting other members of the community involved in helping, when it comes to showing young people other opportunities. So mentoring, I think, is a big influence on folks, particularly those who might be heading down the wrong path.
One more question. I'm full of
Keep them coming.
So,
it's way better than emails.
do you think we're close to seeing a mask mandate back in place?
I don't know, because a lot of that has to do, that's all in the realm of the county. So I try not to make predictions on how the council will vote, not along another completely separate body, right? Because you're just not sure about the variables. What I do know is the places that made it forward during the COVID crisis better than others, and there is no easy choices anymore. There are no even good choices anymore. There's bad choices and less bad choices, right? Because we have to sacrifice a little bit, rather it's wearing a mask or rather it's getting out less, in order for all of us to make it through this the way we want, with the least hurt and death possible. So when it comes to moving forward, one of the things we know about this worldwide pandemic, when you look at other cities in the U.S. and other places throughout the world, is the ones that listen to healthcare professionals who took this as a healthcare crisis were the ones who made out better than other ones. The ones who did nothing, who just kind of left it up to evolution, those ones are still suffering. So we really have two choices moving forward with this. We have limited weapons to prevent COVID. Prevention is the key. Our medical community stands behind prevention, rather that is with a vaccine or utilizing a mask. And we have non-political folks who were hired and appointed to be the top medical advisors to our Board of Health, and hopefully the elected leaders will listen to their own advisors and do what it is we need to do to stop the spread of this thing, particularly because our kids are back in school, and we want to make this safe for our kids because they can't get vaccinated.
And I think they need to be back in school.
Amen. And I want them back in school. I want my kids back in school. But to do that, we have to do our role. And our role is to stop the spread of this, is to slow the spread of this, is to take it serious, not for us, but for those kids who deserve to be back in school. They deserve a good education, and they deserve to be safe. They deserve to not have to be in a situation in which they can catch a deadly virus and possibly wind up in one of our overcrowded hospitals right now. And that's going to take all of us working together, but luckily in Wichita, when it comes to a crisis, when it comes to doing big stuff, we're all hands on deck, and I think that we can get there. Other questions? You guys any quiet, so you good? Text me if you need anything. You guys good? Thanks a lot, guys.